YouTube. Link share कर दो.
Yes, sir. Yusuf sir, I'll be sending the link to you as well on WhatsApp. If you want, you can send it to.
Yeah, चलेगा.
Your.
Sir, आपके group या आपके friends के group पे आपको share करना हो ना, तो you can definitely send them.
Yeah, okay. Do not disturb mode. Okay. Notification करना चाहिए.
Yes, sir.
Shall we go?
Ready. Yes, sir.
Good afternoon, friends. I, Dr. Virat Sanghvi, Secretary, Indian Dental Association, Mumbai West Suburban Branch, along with my President, Dr. Vijay Kedar, my Treasurer, Dr. Pratibha Shetty, my CD Convener, Dr. Jashan Arora, all the EC members, and my co-colleagues and friends, Dr. Gajanan and Dr. Kapil, welcome you all to the series of webinars conducted by Indian Dental Association, Mumbai West Suburban Branch. Request everybody to please mute all your videos, mute all your audios, stop your videos for the smooth presentation so that there is no video lagging or audio lagging. We can hear Dr. Yusuf Chunawala, today's speaker, smoothly, and his presentation will go smoothly. There are few more announcements which needs to be made daily, like the participants who have registered on one of the groups, please don't ask to register them again to us. They are registered on 1, 2, 3, 4, and 5 groups of IDA Mwsb webinars. All the details are going to be sent and posted on these 5 groups. Please don't participate or don't be a member of member of 2 groups or more. Please exit willingly from any of the groups if it is double in you, so that we can accommodate few more people. Question answers for this lecture today, webinar today, are going to be posted by you all in the chat box which has been given below, and we will be asking the questions to Dr. Yusuf Chunawala at the end of the webinar. Dr. Jashan, if I left out, you please do any more announcements. Yeah, for the lectures, henceforth lectures, tomorrow we have a speaker, Dr. Kapil Golwankar, who is going to speak on post and score. After that, once again, we are going to meet Dr. Yusuf sir for bad breath and its management. Then we have Dr. Satish Iyer for pulp treatment in primary teeth. Then we have Dr. Dharamraj Patil, who is going to speak on pulpotomy in rotary endodontics in pedo patients. Then we have Dr. Akshay Rathi, who is going to speak on clear aligners. These are the forthcoming webinars in the next 4 or 5 days. The messages are going to be sent to you daily for these respective webinars. The entire webinar is live right now on YouTube channel of IDA MWSB. Please, people who want to see through YouTube channel can definitely see through it. Also, the previous webinars are available on this YouTube channel. Please go like and share and subscribe to encourage us and help us, motivate us for more and more such programs. Dr. Jashan, if I'm left out with something, please go ahead and announce, and please introduce our today's speaker so that we can go ahead.
Yes, sir. So our today's speaker is Dr. Yusuf Chunawala. He has completed his graduation from Bharati Vidyapeeth and his master from Bapuji Dental College. He is currently working as professor and head at M.A. Rangunwala College of Dental Sciences and Research Center, Pune, and is practicing exclusive pediatric dentistry since last 18 years. He has done clinical trial on curcumin tablet, has launched many projects like Funk Crowns, Instant Ceramic Restoration, Fresh Breath Clinic, Carisol in India. glass fiber reinforced composite ever stick in India. He has delivered over 150 lectures till date. He has many publications to his credit and has run many social camps through the college as well as NGO to be aware and treat children. We have with us today Dr. Yusuf Chunawala. Dr. Yusuf sir, the screen is all yours. Thank you.
Hi guys, just give me a minute. I'll just connect my presentation.
Yes, sir.
Just give me a minute, just a minute. अभी देखा था उसे नहीं Hi everybody, a very good afternoon to all of you all. And at the onset, I'm thankful to your IDA for giving me this opportunity. Actually, this is my first webinar. I've always spoken in front of people. Now, this is technically the first webinar in my life. I've never been live. So if at all I make any mistakes, kindly forgive me and forget about it also. Now we start with the word sunny. What is the word sunny? With the moment we use the word sunny, what comes to your mind? I mean, are we keeping the mics off, or like one or two people can keep their mics on, and if they want to answer, they can answer, because the moment we talk about the word sunny, what usually comes to our mind is the sun, right?
Right.
Are you sure, sir, that sun comes to our mind?
Rightness.
Because the word is very tricky. The moment sunny comes now, the sun is nowadays no longer featured. Many people who are born in the 70s and 80s would be thinking about Sunil Gavaskar.
No, you can think about brightness.
Brightness also, yes, the brightness also is there. And then we can also think about Sunil Gavaskar. And as we move further, we think about Sunny Deol. But currently only this Sunny is coming in everybody's mind, more or less. I may be right, I may be wrong, but this is the Sunny who's in full form these days. And generally when I'm having my presentation outside, I make people stand up and we have a small dance. But now since we are on a webinar and everybody is in a relaxed mode, I don't want you all to stand up and dance. So we will just skip the song and dance part of it. Can anybody guess which song is this? I mean, the song is not there, just the photo is there. So which song can this be possibly?
Rang De Vasanti.
No, it is Jingat.
Jingat.
Previous slide, it is listen to the heartbeat of Maharashtra, and Rang De Vasanti is the heartbeat of India. So anyways, now we come directly to the most important questions, that what do you want as a dentist? Nowadays, thanks to the lockdown, our priorities, our thought process, all has changed, but now we will, try to think a little bit in the past and a little bit in the future also. So what do you want as a dentist? Many people would have joined dentistry for various reasons. Some might have joined because they didn't get MBBS. That is the majority of the cases where people join in because they didn't get MBBS. So they just don't know what they want out of dentistry. Some join maybe because their parents are dentists. And there are some who join because they really want to be dentists. So now if you ask me what I want as a dentist, see, I would want a clinic like this, a lovely big setup, because remember one thing, that if you don't have that wow factor, even if you're a student or a practitioner, and if you don't have a wow factor, that the moment you enter your clinic and you feel wow, or the moment you enter your college, if you don't get that feeling of wow, then you should start thinking about a second profession, because your clinic's interiors or your college and everything should be such that it should keep you motivated all the time. And many have joined dentistry because they want to make a lot of money, because of course there is a lot of money in dentistry also, because we as dentists are blessed with how many teeth? We are blessed with 52 teeth. So we have a lot of work, and we have got 130 crore people. So the amount of money which lies in dentistry is tremendous. So many people have joined in because of the good money and future which they see in dentistry. Now, what kind of clientele we are looking at? And especially since we are talking about Mumbai, majority of people in Mumbai would want the whole of Bollywood to come to them. Am I right? It would be fun seeing all these lovely faces in our setups doing various treatments. Am I right or wrong? Dr. Garima?
Yes, sir, you're right, sir.
Yeah, absolutely right. We want, see, of course, we want to do our social bit also. It's not that, but we want the who's and who to come to our clinics also. And being pedodontists, we want the kids of these guys coming also. Okay, because the kids are in more demand somehow. So celebrity kids, and who's the most famous celebrity kid these days, which all pedodontists would want to come to their clinic? Mostly Taimur. We are waiting to treat Taimur, especially in Bombay. And then cricketers also, because see, Bombay is a hub where you'll get these kind of crowd, but there are other cities also. So the basic idea is that we want the best people to come to our clinics also. And what will we do when they come to our clinics? What is the first thing that we are going to do is mostly we're going to click a selfie. Am I right? Because selfie is the first thing that we want to do whenever a celebrity patient comes in. And just imagine your reception area. Of course, now the distances will be more. They will not be standing so close to each other. But this is the kind of people who we want to be in our reception also. Okay. If you can say yes or no, it will be wonderful, because I'm not used to talking one way. So if you agree, you can say yes. If you disagree, you can say no also.
Yes, sir.
Then to be successful,
yes, of course.
Pardon? This
Yeah,
Arab
yeah.
is genuine. This Arab, can you consider him as successful? Such a big family he's got. Okay, it would be wonderful. So now this is a clipping of the movie. Can anybody guess the movie?
Three Idiots.
Perfect. Now in this setup, what does Amir Khan tell to these guys? That you do not run behind success. Success ke mat piche mat bhago. Excellence ke piche bhago. That is what we lack. Many of us lack these days. Everybody wants to be successful, but nobody wants to do excellent work. See, being dentist, what should be your motto? Like the day you do a filling, you should feel that satisfaction. Oh my God, this is the best filling I ever did. Or this was the best root canal I ever did. Or this was the best extraction. Excellence should be our aim. That's what he said. And once you are excellent, success will definitely bounce in. So my simple question to everybody, do you want success and as well as excellence?
Yeah.
Only one person saying, yeah, everybody can be on, and they can all say yes.
Yes, yes.
Yes. Who's that? Who's that? That's a lovely voice. Who's that? So yes, everybody wants this. So what I'll do in this 1.5 hours which you have allotted to me, I'll give you only an idea. I can't do beyond that, Okay, and I'll give you a very small idea, and believe me, that idea can change your life partly now. Okay, as it is, thanks to this little virus, our life is so different. But after the presentation, your life will be a little more different. And believe me, the longer you stay for the presentation, the more you will gain. I assure you that. Okay. So now the first idea, generally my ideas are always followed by a celebrity and a song, but somehow I could not manage the song this time. So this is idea number 1.
Hello.
Now what is the main idea today is that management of pain. Okay. Because understand one thing is the main reason why any patient comes to us is because of pain. Okay. In dentistry, of course, there will be other reasons like aesthetics. So, one thing we have to be thankful that There is pain, that's why patient comes to us, and there are anteriors, that's why patients come to us. That is the two prime reasons why the patients come to us. Now, pain management is the most critical and important thing. Now, understand, how does a patient come to a dentist? Does he come directly? Is he so well motivated to come the moment he sees something wrong in his teeth? Does he just jump into a clinic? No. Dental patients has a proper protocol. I mean, the moment your tooth starts paining, the first the medications is initially given by the parents or the caretakers or the friends. So few days go with the help of friends and parents, and then it so happens that the pain is little continuous and it is increasing. So then you go to the pharmacist, and then finally he prescribes some medicines and you take the medicine. And then when finally you can't sleep for 2-3 nights, that's the time you actually visit a dentist. Okay, so now the patient has come to us after going through such a long circle. So dentistry is not liked, it is not wanted, they had to come to us. So understand, the patient has come to us because he had no other alternative. And the first appointment, I always say, is the most critical appointment, because that's where the trust building takes place. So it is how you manage the pain. Okay, so now this whole presentation, as you all know, is the journey of pain and its management. So there are two types of pain, basically: the pain that hurts you and the pain that changes you. Okay, now if you look at a dental clinics, they are mostly very amazing. They look very nice. We have lovely chairs, we have lovely instruments, we have the best compressor, we have the best suctions, RVGs and everything. But look at it closely from the patient's point of view. None of our equipments look good. I mean, if you look at a probe, okay, you can't tell the patient, see boss, this is a U3D probe. For him, it is something sharp and pointed. So, okay, most of our instruments are very dangerous to look at. Okay, and of course, injection is always there, And the other thing is, there is always fear of unknown. I mean, in dentistry, everybody, even many a times, even the dentist himself is scared to be his own patient, because a variety of pain are there. And plus the position in which we are doing the treatment, most of us are doing it in the supine position. Okay. So when the patient, or when you are sleeping in that position, the route of escape is very less. You actually feel very intimidated, because the moment you lie down on the chair, the next thing is we pull in a trolley, then we pull in the light, and then the assistant comes in. So the patient is technically surrounded by 3 to 4 people, and with all the equipments over their heads, it's genuinely a very, very scary scenario. Okay, so now I'm going to take you to a journey from painless to pain-free dentistry. Okay, now painless means what? There is less pain. And what does pain-free mean? There's no pain. Okay. So now the first topic which I would like to discuss today is topical anesthesia. Now, many of these topics you might find, they are so simple. I mean, what is there to be discussed in that? I mean, but it's just a review, because since I'm talking about pain, I always like to begin with topical anesthesia. And many of us are very happily using the spray bottle. Okay, how many of you all are using the anesthetic spray bottle? Any one of you all are using the sprays?
Yes, sir, many of us.
Yes, sir.
Yes, sir.
Yes, and the spray is lovely.
Yeah.
Yeah, spray is lovely. When you try to put it, okay, you take the spray bottle and you press it. Does the spray come out immediately? Never. Then you have to just shake it up and then you spray. And then in that attempt, what happens? You spray in a lot of solution. So your point of insertion, where you wanted to actually give the needle, that also has got the topical anesthetic, and it spreads everywhere. Okay. And believe me, if you have never experienced the topical anesthetic, how does it taste? Spray it like a perfume in your mouth and see what kind of feeling is, you experience. It's definitely a very choky feeling. Okay, so the simplest procedure first is that you dry that area where you have to give the topical anesthetic. And if possible, please discard the spray, because the spray is no good. What you require is a gel. A lot of companies are providing with good quality gels. You carry the gel, okay, on a earbud, apply in that area where you are going to insert your injection, insert your needle, and then place a small cotton ball and wait for 30 seconds or a minute. We are always in a hurry. I mean, somehow I have noticed in dentistry, all of us are in a hurry. Okay, the hurry should not be there. Wait for 30 seconds to a minute, and then you apply. Then you insert your needle. Okay, that's the basic that you have to follow. So if at all you are using those spray, please discard them. A proper topical gel is always advisable, and placement of cotton after you apply the topical anesthetic gel is mandatory, so that the solution remains in that site and the action takes place. Okay. So now what does this topical anesthetic do? You know, the pain of the insertion of the needle is taken care by it. And then there is something called as cryo-anesthesia also. Now, what do you mean by cryo-anesthesia? Cryo-anesthesia is basically a very simple mechanism. That is where you apply, after you applied your topical agent, you just apply a little bit of ice in that area. You know, what happens that the cold receptors are excited by the temperature below a set threshold, and it generates the impulse that traveling mainly via the A delta fibers. And the patients, you know, are unable to discriminate between sharp pain. So even application of the ice does help. So now understand that don't take out the ice from the fridge and then break it with a, you know, the reverse side of your elevator and put a piece over there. We always have these small dubbies with us. These are our special paper points, the dubbies, and you can always use it regularly. It definitely works. So if at all some days you don't have your topical anesthetic, you can always put your ice and go ahead with it. There is definitely reduction, or the patient doesn't experience the pain of insertion of the needle. Now, what have we done these days? You know, previously, if you remember, we used to have very thick gauge needles, you know, 21 gauge needles, 19 gauge. You know, the gauge used to be quite high. And, you know, plus we used to use the reusable one. So the tip used to get blunt and the patients used to really jump in pain. But nowadays we are lucky, we have got even 30 gauge needles. Okay. So it is always best to use 26 onwards. The thinner the gauge of the needle, the better it is. You know, so the pain of insertion is definitely taken care considerably. I mean, you can even use a tuberculin syringe, you can use an insulin syringe, but the problem with the syringe is that the amount of LA that you can load is very less. Now, generally, most of us are very busy practitioners and we have a lot of patients. I mean, do you agree most of our blocks we can give in less than a minute's time? In 1 minute, we are done with an inferior alveolar nerve block or a posterior superior alveolar nerve block, or even our infiltration. I mean, both sides, 30 seconds to 1 minute is the maximum time we take. Do you agree? I mean, does anybody agree, or there are people who take longer duration of time?
Longer duration of time.
So you take longer?
Yes.
Okay, that's very good. But majority, since nobody has answered, means what, that they have given the solution very quickly. Now, have you experienced that even after applying the topical anesthetic, the moment you place the needle, there is no pain, but as you give the solution, pain is there. What is the pain due to?
Pressure.
Any guesses? It is pressure. Okay.
Pressure.
Now the pressure. Now the concept of pressure can be explained in a very simple terminology. How many of you all have experienced constipation? Anybody has experienced constipation?
Yes.
All of us.
All of us, yeah, it's an amazing feeling. And when you are constipated and when you go to the bathroom, the attempt is amazing, right? And you try to put in a lot of pressure and then you undergo a lot of pain. So that's what is happening. Because when you are giving your local anesthetic, you have the pain of insertion is taken, but you tend to deposit the solution very quickly. Majority of us are able to give the block or an infill in less than a minute's time. And the reason is never understood. Okay, why? What is the hurry? Okay, now what we generally do is now that your injection should be like diarrhea. How many of you have experienced diarrhea? Nobody? How many of you all have experienced diarrhea? Anybody has experienced diarrhea? Oh, everybody
Yes,
has
sir.
kept
Yes,
their
sir.
minds.
Yes, sir.
Yes. And diarrhea is a very, very amazing feeling. You know, the people who have diarrhea are quite cultured. Do you know that? The people, anybody who's suffering from diarrhea is very cultured person. He will not laugh loudly. He will not talk loudly. He will be very, he will be very polite. He will never be in a hurry because he tries to laugh also aloud and something will go wrong. And what happens when you have diarrhea and when you go to the bathroom? Okay. So that's how your local anesthetic injection should be. So Malamud has, you know, very specifically suggested, you know, that the rate of the injection should be 1 ml a minute. That's how slowly you have to give the local anesthetic to the patient. I mean, any infiltration or a block should take you at least 2 to 3 minutes. Because by doing that, what happens? We have eliminated the pressure. Now, most of the times what happens is that the good quality needle and good quality topical is used, but because of the pressure, the patient experiences severe pain. Okay, so now the first device that we are going to discuss today, which works more or less on a zero pressure injection, zero pressure technology, is the computer aided anesthesia delivery system, that is the STA or the wand device. Okay, now the basic principle here is very, very simple. Okay, here what happens, the pressure is minimal. The gauge of the needle is 26 to 30. Okay, but the pressure is controlled and it is very much less. That's why there is no pain which is experienced by the patient. Now, what will I do is that I was unable to load the videos immediately. So what will I do is that towards the end of my presentation, I will load the videos of all these devices. So you'll actually get a live demonstration of how this system works. So now this works on a dynamic pressure technology. So what happens? The pressure is minimal. Now this is the video. Unfortunately, it's not playing right now, but we are compiling the videos at the end of it, and I will be definitely showing you this video. Now, most of you will agree that the palatal injection is the most painful, right? And various theories are proposed to make the palatal injection simple, because inferior alveolar nerve we block, we manage, buccal infiltration we manage, whatever kind of injections we manage, but the palatal injection is what we are worried about the most. So now for the palatal injection, believe me, the STA is one of the best things that you can use actually. But, and remember, like we have been taught some gentlemen have always told us that look out for blanching in the palatal aspect, and then in that attempt to see the blanching, what happens, we apply a lot of pressure, and because of the pressure, there is severe pain. So in the palate region also, you have to inject very, very slowly. Okay, very, very slowly is the way you inject in the palatal area. And then there is another device. This is called as the dental wipe and vibrajet. Okay. Now what happens is we will not discuss the dental wipe because dental vibrajet, because somehow I was not very comfortable with it. So whatever I'm not very comfortable, I avoid discussing, because it's not great fun. The enjoyable part is using the dental wipe. Now this dental wipe, it works on the vibration delivery system. Okay. Now can anybody guess which movie is this from? This is the big discussion which Amir Khan has in Three Idiots with Raju. Now here is where he discusses that this Raju is very scared of always the exams, and he's doing all various stunts to get his exams done. And that's where Amir Khan explains the episode in his village, that in that village, they have a watchman, okay, who is in the night all the time, making noise and, going and asking everybody, whether everything is well or no and all. And he keeps on making the noise. And then one day a robbery happens and they realize that this bugger is blind. Okay. So that all is well principle is there. So that time, what Amir Khan says, that time he understood कि जो अपना दिल है बहुत कमजोर है, उसे बेवकूफ बना के रखना होता है. So this dental dental vibe works on this vibratory principle, that is the gate control theory of Mwsb. This theory, what it states, that if two stimuluses are going to the brain, only one is accepted by the brain, the second stimulus is not recognized. So what happens, with this dental vibe, this is how the dental vibe looks. Okay, it is more or less, it looks like, our electronic toothbrush. Now there is a vibrator machine which is attached to that, and there is something called as the comfort syringe, and you have the injection. So after you have applied your topical anesthetic, you place the comfort syringe like this inside the sulcus or wherever you have to give the anesthetic. So what happens, the vibrations begin. So what happens once the vibration begins, okay, the vibratory stimulus reaches the brain, and your pain of injection is not felt by the patient at all. Okay, now you might not believe it because the video is not there, but I'll definitely show, and it can be given buccally, lingually, palatally, and be assured that the patient will not complain of pain because the pain stimulus is not reached the brain at all. Okay, this is the video. I will be showing it towards the end of the presentation. And generally, I have Amrish Puri saying that Mogambo Khush hua, because every idea that I propose, then everybody likes and claps. So it is, that's why I've put Amrish Puri over there. And this is my idea number 2: drill-less dentistry. Now this suddenly has picked up. I have been speaking on this topic from almost 18 years, but it was moving very slowly. But now, thanks to this lovely virus that has entered our life, using the air rotor has become quite a worry for all of us. Am I right? Because everybody is talking about the aerosol, that what will happen, how will we use the air rotor, how will we do the RCO. Now we are all planning for extractions and the headgears and the PPEs, everything has been proposed. So now drilled dentistry might help us a little bit in this particular aspect. Now generally there are two types of noise, many types of noise are heard in the clinic. I mean, can you tell me which all noises? Is a dentistry a very silent branch, or there is a lot of noise?
No.
Noisy, sir.
It's a noisy setup. There is a noise of the suction, there is noise of the drill, there is noise of the child as far as the pediatric dentistry is also concerned. Then, of course, the air rotor, the suction, the compressor, all this makes a lot of noise. And when there is silence, do we enjoy it? What does silence indicate? If there is silence in your clinic, what does this indicate? That the patient is medicating or meditating, or the doctor is meditating? Silence in the clinic indicates that there is no patience. Okay, and that's what we don't like. Okay, now if you understand noise, we love noise at the times of Dandiya, at the times of Ganpati time, or even in a party, we love the noise. But the crying sound of the child is never liked by us at all. Okay. So now today we are going to discuss a little bit about drillless dentistry. Now, what does drillless dentistry mean? Drillless dentistry basically mean that we are going to use the drill, but very less. Okay, very, very less. Okay, because if you ask the patient what are the two things that cause a lot of fear and anxiety in the dental office, it is the drill and the injection. Okay, so in the previous slides, I showed you how you make your injection painless or technically pain-free. And now if you don't use the drill also, or you use the drill very less, the patient is going to be very happy. Now, see, now understand that in this concept, sorry, this concept is also called as the silent revolution. Because when you're using this particular method of caries removal, what happens? The amount of sound that is going to happen is very less. And here we are going to discuss something called as the chemomechanical caries removal system. Has anybody heard about chemomechanical caries removal system? Anybody heard?
Yes, sir. No, sir.
See, now the chemomechanical caries removal system is a very simple system. Now, what does the word indicate? That there is something chemical, okay, and there is something mechanical. So you have a chemical which will act on the carious lesion, and you have a mechanical thing that is an excavator. Okay, now this excavator is definitely going to help you remove the caries. Now, basically, we are going to divide the chemomechanical system into three parts. Caridex, again, I will not be discussing because that system is no longer available and not very much accepted. So why discuss it in this critical situation? So what we are going to talk about, Carisol, Papa Caries, and few of the systems which are currently very, very much available. And believe me, in this time of COVID, these systems will be very much in demand. Now, what is Carisol? Okay, Carisol is basically a patented product which is developed in Sweden, and it consists of a gel. And of course, since it's a chemomechanical, there is a gel and there is a special set of excavators. Now, what does the gel contain? Now, the gel contains sodium hydroxide and amino acids. And sodium hydroxide, in the amino acids, we have glutamic acid, lysine, and leucine. And the part 2 is sodium hypochlorite. So when this part A and part B is mixed, there is something called as chloramines which is formed. Now, what do these chloramines do? Now, these chloramines act on the degraded collagen meshwork of the carious dentine. Okay, and they disintegrate it further. And then these further disintegrated broken collagen meshwork, that is the carious dentine, is very easily removed with the help of these caries special excavators. Now, what is the speciality of the Carisol instruments? Now, see, remember one thing. See, whenever these systems are introduced, now we always like to have a shortcut. We will buy the chemical, but we'll not buy the excavator. We'll say that I've got a very good quality excavator of my own and I'm not going to pick it up. Okay, that should not be the way we should follow. Whatever system is introduced, you have to follow it. Then only the optimum results are obtained. Now, what is the speciality of the Carisol instrument? That they have sharp edges, blunt cutting angles, and they act on a larger support area against the underlying surface, and they help in effective and controlled caries removal. Now, all of us have come in contact with a deep caries lesion. Now, many a time when you're putting your air rotor, it doesn't work at all. Okay, so what happens is, then you use your micromotor, and many a times you use your good quality excavator, because if you use your poor quality excavator, it is as bad as the air rotor and no dentine comes out. Now, what happens with your good quality excavator? As you try to excavate, there is some amount of pain and discomfort which is experienced by the patient, because what happens, these high-tech good quality excavators which we routinely use for caries removal in our clinics, not only they will remove the caries dentine, but they will remove the normal dentine also. Now, in the slide at the corner, you see the Carisol instrument. They have sharp cutting edges and blunt angles. So what happens, they remove, as they move, they remove from the sides and the base gets cleared. Okay. Now, the steps in the use of Carisol is very simple. It is available like a double two-barrel syringe, and then you mix it, and then you carry the liquid and place it on the caries surface. Now, understand, Carisol or any of these chemomechanical agents, they will act only on the caries dentine. They are not of any use for the caries enamel. Okay, they don't work on the caries enamel at all. So, so the caries dentine has to be visible. So many a times you see an intact tooth surface, and if you're on a radiograph, you see some areas of hidden caries. So you have to actually reach the caries lesion. The caries lesion has to be visible. Then you place a drop over it and wait for a minute. And then you start removing the caries. And you will notice that after a minute, with the special Carisol excavator, the caries gets removed very quickly, very nicely. And but a stage is reached where you still see that a lot of caries is still there, but nothing is coming out. That indicates that you have to add the gel more. Okay, then the second helping of the gel is placed, and then you continue with the excavation. Then a stage will be reached where nothing comes out, and you can understand that the caries surface, caries-free surface has been achieved. How do you come to know? How do you evaluate? One is the rough surface texture, the dentine color, and a caries indicator dye also can be used, and of course the frosted appearance of the on air drying. And once this is done, you have to stop. Now, what is the next step? The next step is that you rinse the cavity. I mean, you flush the cavity with the normal saline or your water, and then you can do whatever routine restoration you want. Carisol doesn't have effect. I mean, it will not have any role in as far as the choice of restoration is concerned, or nor will it hamper any property of the restorative material. So this is how you evaluate. Now, a small comparison. Okay, what is the comparison between drill and Carisol? Now, drill is invasive. I mean, it will go everywhere, and wherever you touch, whether you want or you don't want, it is powerful. There is low precision. I mean, if you shake and you'll cut more, it is non-selective. It will remove the caries dentine and the non-caries dentine also, and it is often painful and unpleasant. What about Carisol? It is minimally invasive, very careful, precise, and it selectively removes only caries dentine. Now, why does it only remove the caries dentine? See, because what happens, this chloramine which is there is unable to permeate to the intact collagen meshwork of the regular dentine. So since the chemical doesn't go through, no normal dentine will be removed, and plus minimal pain, and it is highly comfortable. And see, the psychological component is also there. The patient feels, okay, no drill is used. Wow, I mean, they tend to cooperate. And believe me, in these trying times, we can, I mean, first, me being a periodontist, I thought I've always used it for kids, but now I have noticed that you can use it for adults also. I mean, dentine is dentine, caries is caries. I mean, there is not much of a difference. So it becomes a good tool for adults also. And many a times what happens, we come across kids, you see a non-vital tooth, the anteriors especially, and you just have to do the root canal opening. And you're telling the child that the drill will not pain, no injection, but the child doesn't agree. So in such a situation, the Carisol gel works. And now one thing that we always fear, see, whenever a patient comes to us with a deep carious lesion, there is big amount of tension. I mean, sometimes by looking at the X-ray and clinically, we very easily tell, okay, the question with the patient now, see, can you see this aspect? This is a pulp exposure and this is no pulp exposure. So we tell the patient it's going to be just a filling, and then as you are excavating, suddenly see a pulp exposure. Then what do you tell him? How do you explain? So in these situations, be aware, and especially in kids, many a times the pulp exposure is heterogenic. The child suddenly closes the mouth, the child moves. So in such a situation where you started as a restorative, for a restoration, you end up with a pulpotomy or a pulpectomy. And many a times the patient will not accept it. So in these situations, Carisol gel works. Whenever you feel that there is a chance of a pulp exposure, you place the Carisol gel and slowly start the excavation. And believe me, if the pulp is not involved, okay, if the pulp is not involved, the Carisol will not expose the pulp at all. That is for sure. I mean, you will not land up, because we as dentists have delicate hands. अपना कुछ 2.5 किलो का हाथ नहीं है ना कि हम pulp भी expose कर देंगे, बराबर? Okay, then so now, since you all are placed in Bombay, Bade Mian, Delhi Darbar, Kareem's, all these places, you might be remembering now, no? Yes or no? I'm actually getting dreams of these kind of things, because we are really missing all this stuff. Okay. Now, what is the speciality of non-veg things? I mean, sometimes, they become so soft and silky like paneer. So you wonder how come this, meat, how did this meat soften? So the basic process involved here was marination. Okay. And in marination, various components. See, now because of this closure, many of us have become part-time cooks also. Any of you all have started cooking? Anybody?
Yes,
Yes, sir.
Yes, many of us, I'm not talking about the ladies, the guys have become cooks, and believe me, I have become basin king now. I mean, I am making bhajiyas, kanda bhajia, potato bhajiyas, basin toast, and you name it. So the cooking skills get enhanced. So as far as non-vegetarian cooking is concerned, the thing which helps in the cooking and marination is papaya. Okay. So papaya is one of the main components as far as marination of non-veg is concerned. Now, what is, so the concept came in from papaya. So what does papaya contain? The papaya contains papain. Okay. And this papaya led to a discovery of another chemomechanical caries lesion that is called as the papa caries. Okay. And the main component of papa caries is papain gel. And of course, chloramines is always there. Chloramines is there, then you have toluidine B, salts, preservatives, vehicle, and a thickening agent. But the basic components is papain gel and chloramines, and it has got exactly the similar mechanism of action like the Carisol gel. Okay. Now the only advantage of this gel is what? Instead of a two-paste system, it is a single gel. So somehow many prefer the single thing. Why mix two when one is available? Okay, so that is also a good point. And of course, we have some Indian products also which have come in. That is Care is also there. And of course, it also has the papaya extract, clove oil, sterile water, chloramine, and sodium chloride. Okay. And generally they are blue in color. So what happens? It becomes easy to differentiate where it is. Once you place the gel, if it's a transparent thing, sometimes it will get mixed out with saliva and you'll not be able to note whether there is saliva or there is this gel. And of course, the basic mechanism of action is same. What is this? The mechanism that you place the gel on the carious portion for 30 seconds, then you start excavating. And of course, in this also, papa caries or the other caries systems, they never develop their own excavators. So I always prescribe that use your Carisol excavators for this system. Okay, because nothing better than the Carisol excavator, and they work for all these systems. They are the most lovely pair of instruments. And believe me, once you buy them, they should at least last you for 10 to 15 years. That's the quality which Sweden is providing us. So the step is simple. You apply it, then you start with the excavation. Then a stage is reached where what happens, all the caries is come out. Then you follow it up with a restoration. Now, can you see the restoration? Can you see my restoration over here? Is it visible to everybody?
Yes,
This
sir.
one?
Yes,
How is
yes.
the quality? The quality is amazing, right? Isn't the quality good?
Yeah, very good, sir.
What? You're lying, yeah, it is horrible. I have not used a matrix band also. So this is what is this, such poor restoration has been done. But in pedo now you have a lot of life, you get saved, then you put a nice crown over it. So you never make out what was done below. And one beauty about pedodontics is that, the child's cooperation can always be blamed sometimes for your bad work. Okay. Any pedodontist attending? then they will have maybe variation in opinions. But generally, when you can always give the reason that the child was not cooperative for your bad activities also. Okay, and on top of that, you put in a crown. Okay, that's the most beautiful part about pediatric restorations and crown, that you don't know what's happening, and later on also, if there is any problem, the tooth might not be there. Okay, so that's the beauty that happens. And then, of course, new products like Bricks 3000, like Papin, is also available. If any one of you all can come across the same principles. And here Amrish Puri is also very happy. And then there is idea number 3. Who's this lady? Can anybody tell me?
Malaika.
Yes. Now, is distraction good in life? Distraction is good or bad?
Good.
Pardon? Distraction in a way is good, in a way it is bad also. As far as dentistry is, I mean, these 2 videos are also there. This also I'll show you a little later. Okay, what are they? They have all the concepts. This is basically a pediatrician who is giving a shot to his patient. Okay. And in dentistry, audiovisual distraction is very, very important because as I told you, most of the devices which we use are not very lovely, and especially the injection. Okay, that's why in college or everywhere, everybody is taught that never load the needle in front of the patient, because the sight of the needle and the injection scares anybody. I mean, that principle works for even for adults, because even adults get scared, and children, of course, get scared more. So nowadays, a lot of use of audiovisual aids has been there. A lot of earphones are used. I mean, you place the earphone and the patient is quite comfortable. Then some patients, some dentists have put the TVs on the screens, or they have the laptops on their chairs. So the patient is occupied, but it's not so effective. So now I bumped into this special audio-video device, which can be, placed like a pair of glasses, and it has got a ear plug also. You have something in the ears, and then you can put a CD or a cartoon or a movie of the choice, and the patient is busy watching that. Okay, now the beauty of all these things is that once the attention is distracted, I mean, they don't know what is happening. See, because we have taken all other care, like our injection otherwise is painless only. I mean, you have applied the topical, you are injecting it slowly, or you have the wound device, or you have the dental vibe or the vibrajet, or you're using the cryo thing. So you have managed the pain, but the sight of the needle and the syringe scares the patient a lot, and that's why they become uncooperative or apprehensive, and they become anxious. So this device, once you place it, see, because what happens in dentistry, you can't say you can't hide the injection, because whatever you are doing right below the nose. Okay, and the eyes is right there, and you ask the patient to close his eyes, it is impossible that they will keep their eyes closed, because the moment you tell somebody to close his eyes, there is some amount of apprehension, there is some amount of fear, so they will get scared. You just can't keep your eyes closed. So this device definitely works. Here also we have 2 lovely videos, and I will definitely try to show you at the end of the presentation. I'm just trying to get the videos organized, and it works well for everything. I mean, for a local anesthetic, for the drilling, for a root canal, the child is just not aware of it, and it can be used wonderfully for adults also. See, because whatever makes the child happy, it makes the adult happy also. I mean, if the child is happy with a chocolate, aren't we also? If the child is happy with a small gift, aren't we also? So what the children or the adult, they are all same when they are on the dental chair. Whatever a child likes, the adult definitely likes. Okay. Here we have him twice. Who's this lady? Any idea?
Anushka Sharma.
Yes, thank you. That may I just reconfirm, because you should not go off to sleep. Which song are we playing over here? Can anybody guess?
Baby ko
Yes,
baby.
wonderful. I mean, I wish I could play all the songs. Maybe, the presentation which happens on Monday, I'll try to put in all the songs also. Now, we discussed a little bit about painless injections. We spoke about, drill-less dentistry also. And now what we're going to talk about is pain-free dentistry, drill-free dentistry, and noise-free dentistry. Is that possible? That there is no pain, there is no drill, there is no noise. Which procedure can we do this way? Maybe the fluoride application? Am I right? Maybe the application of a Pitton-Fisher sealant. Anything other than that, can we do pain-free, drill-free, and noise-free? Any guesses? Impressions? Yes, very good. Thank you, Dr. Somesh. Anything else? Now, the material which I love, and again, believe me, my presentation, I'm loving it more and more because, whatever I was speaking from past so many years, suddenly in this virus wala time, it has become more and more important. I mean, here now we're going to discuss about silver diamine fluoride. Has anybody heard about silver diamine fluoride?
Yes, sir.
Yes, many of you all have heard.
Yes,
Silver
sir.
diamine fluoride, yes, it's a wonderful material. Am I right? It's a wonderful material, but if you go to the previous slide, the main property of this material is, what? It is pain-free, it is drill-free, and it is noise-free. Can you beat that? I mean, those who have not heard about it, please, I mean, you should. I mean, this is the material that is going to be in your clinics from the day the lockdown opens. I mean, you have to buy this material because practicing dentistry without silver diamine fluoride is going to be a little difficult now. Okay, because even the chemomechanical systems will become all the more important, and the SDF is going to become very, very important. Now, what is silver diamine fluoride? Okay, silver diamine fluoride is basically a combination of silver, diamine, and fluoride, 3 chemicals put together. Okay, and it is, I mean, the best thing that we as periodontists have ever received, that it has the feature of a drill-free dentistry. If you have silver diamine fluoride with you, you do not require drill, you do not require the injection, you do not require anything. All you require is your silver diamine fluoride, a few cotton rolls, Vaseline, and an applicator tip. Okay. Now, what is the silver diamine fluoride? Why am I stressing on this? And my most major part of the presentation is going to be on silver diamine because this is the material that we are going to use day in, day out from now on. Now, what is silver diamine fluoride? It is basically a colorless liquid. The pH is around 10. It contains 25% silver, 8% ammonia, and 5% of fluoride. Okay. Now, I will take a 2 minutes break because now I have to again reload my second lot of slides. So just take a break for a minute. I'll be back again. Okay.
Thank you, Yusuf, sir. It has been really great listening to you. People
No, it's
are
not
really
over. It's not over at the end.
I know, sir. I know, sir. It's not over. I know it's not over.
I'm coming back. I'm coming
Yeah,
back.
I know.
Yes, yes.
Friends, have a great time. Hope everybody's enjoying it. We have Dr. Yusuf Chunawala back once again in a minute. Sir, if anybody has a question till now, can I ask them?
Yeah, I mean, see what I'll do at the end of it. Now you can have a direct question answer session. It will be easy because
No problem, sir. No problem, sir. Sure.
Because most of these things are by heart, so I don't need the slides or anything.
No problem.
Just
Friends,
give me a minute.
Yeah, sir.
Loading these things.
Friends, we have him once again on Monday, specifically on bad breath, 1.5 hour session on bad breath, causes, etiology, how to take care of it. And it's also going to be in Bollywood style, bad breath in Bollywood style.
And Bollywood here now, I have to, the first thing, after the lockout gets over is I'm going to buy 2 laptops.
At what time?
3:30 in the afternoon, same time.
Same time.
3:30 in the afternoon. Friends, there are plenty more webinars which are going to take place. All the webinars are going to be, the brochures are going to be posted on IDA Mwsb groups, webinar groups from 1 to 5. Group 1, Group 2, Group 3, Group 4, and Group 5. All the participants are requested to please check the groups. If anybody of you are not interested in this webinar, please exit the group so that we can accommodate the new people in it.
I think some sharing is going on. Can we stop this?
Yeah, sure. So you are ready? So
yeah, I'm ready.
Yeah, Dr. Jashan, please stop. Yeah, sir.
Where did it go? Oh my God. I mean, just wait again because it got deleted again. I'm just doing it again. Just nobody do anything for a moment, please.
Sure, sir.
Yeah, because what happens now, there is I'm little new to this iPad.
Yeah.
because the moment it gets anybody else puts in something, now the whole PPT goes for a toss again. I'm just loading it all over again.
Yeah. Hope everybody is liking the series of webinars on knowledge-based stuff. This entire webinar is posted on YouTube channel live. The previous webinars, entire series of root canals, meditation, asepsis, sterilization and infection control, and many other webinars are posted on YouTube channel IDA MWSB. Please go like, share, and subscribe to the channel. This is the 19th webinar in the series during this lockdown period.
Yeah, now I'm back again.
Yusuf sir is back, sir. The podium is yours.
Hi guys, so now we are back with the silver diamine fluoride. As I mentioned to you about the basic composition, now what is the basic property? Now a lot of theory I have put in is because, you know, this particular chemical, I mean, believe me, at the end of the webinar, you'll definitely be looking for buying this, because, you know, it can be used very easily by each and every one of us, and no great armamentarium is required for this. Now, the basic property is that the moment you apply silver diamine to a carious tooth, to the carious portion, the caries gets arrested. Okay, the caries just gets arrested, and once the caries process is slowed down or arrested, caries removal bit can be done at a later date also. You know, so we are technically buying time. Okay, so, and believe me, this has been well researched. Okay, it's not that it is something very new. I mean, this material has got a history of 100 years basically, and people like McDonald, Braga, and all various studies have substantiated that 38% SDF gel is SDF gel provides an alternative where restorative treatment for primary teeth is not an option, and nowadays you can use it in a permanent tooth also. You have a patient with a lot of multiple caries lesion and you don't want to use the drill. What is the option left with you? I mean, you just can't leave the patient just like that. You will say, what happens if it moves further? Because nowadays everybody is aware that the caries will progress. So this agent acts like an arresting agent. Okay. Now, as far as children is concerned, it works amazing. Okay. And you know, like, see what happens many a time, the children are with multiple carious lesion. Okay. And many of them can't afford treatment, or many of them are very uncooperative, or some don't want to go treatment under general anesthesia. So in such a situation, you just apply the SDF gel and that's about it. And you can recall the patient after 6 months maybe. Okay. And it helps in prevent spit and fissure caries also. Okay. Now, as you know, pit and fissures are very much susceptible, and incipient caries lesions will be there. So you can actually apply the the SDF gel over it, and the caries process is slowed down. Now it can be used for prevention of secondary caries also. See, many restorative materials used in dentistry today are, they truly adhesive kind of thing, and they're completely insoluble. Okay, but there is always chances of recurrent caries, especially there will be many patients with an amalgam restoration. Okay, so what will you do in such a case? I mean, at the border of the restoration, you can just apply this gel. I mean, once the patient is in recall, not in the initial stages. And it can be used to arrest root caries also. Okay. And it is used to desensitize sensitive teeth. It has the, because the SDF has basically ability to occlude the dentinal tubules, and it can give promising results in patients with dentine hypersensitivity. And it really works well. And it's used to treat root canal infection. Now, this is a little new area which was proposed long time back, but now it is coming up again. But the specific material is not so easily available, so we'll not discuss at least this in detail. But the SDF by itself, the 38% SDF which is there, we'll discuss that very much in detail. Now, the only drawback of silver diamine fluoride is what? That after you have applied the silver diamine fluoride, the lesion becomes stained. Okay, because that is the property of silver. I mean, the moment it comes in contact with water or moisture, the color will change. So what happens? Some children and parents don't like the aesthetic outcome. And especially studies have shown that when you put it on the anteriors, they really don't like it. But for the posteriors, they don't mind it because it is not visible. Okay. Now, to overcome these limitations, many activities have and many chemicals have been proposed. Many chemicals have been proposed. For example, they have used potassium iodide after application of SDF to the tooth, and they have found that the blackish discoloration is reduced considerably. Okay, but this chemical is available with only one of the products, which is manufactured by one of the Australian company. The other products which are available don't come with the potassium iodide gel. Okay. Now, SDF of course can also stain the skin of the body and clothes, so you have to be a little careful when you are using it. Okay, and of course, once it's used in the mouth, also a little bit of metallic taste is there. And of course, gingival and mucosal irritation can also occur, and in almost all the cases, the damage is transient and the affected tissue turns white, but it will heal within a day or two. So what we generally do is that application of Vaseline is done on the lips and the sulcus areas, and if possible, you can always use a rubber dam to protect the gingiva. And of course, you can protect the gingiva with cocoa butter or Vaseline, as I already mentioned. It is definitely a very safe product. Okay. And no great complications have been reported in literature, along with sodium silver diamine fluoride. Now, it has been proposed as an indirect pulp capping agent long time back, because many a times you see a deep carious lesion and you know that the further excavation might lead to a pulp exposure. So in such situation, you just apply the silver diamine fluoride and it tends to arrest the dental caries, and further progression is arrested. Now, it has also been found in animal experience almost 50 years back that there is no serious effect histologically on the pulp by the application in medium-sized cavities also. And of course, it can be used as a atraumatic restorative technique also. Okay, and it works very nice. One second. And what has happened is that many a times after the arrest of the caries, the next question is, should we restore it or not? You have two options as far as when you have used the silver diamine fluoride. Many a times, especially in children, okay, we just apply the gel and tell the patient bye. Okay, but you can't do that always, and you can of course do your routine restoration, but it has been found that the bonded restorations like composite and all, some issues, some authors have proposed that they don't have adequate strength, and some say they don't adversely affect. So there is a dual view. So most of the time, as far as its kids are concerned, I would always prefer to give a GIC restoration over it, or directly a crown after application of silver diamine fluoride. Now, the basic conclusion about silver diamine is that the reports of the studies available suggest that 38% sodium SDF may be an effective agent in arresting the caries in primary teeth, and I will add the permanent teeth also. No severe pulpal damages after SDF application. And SDF is a simple and quick to use and an affordable therapeutic agent in a developing country. I mean, there is no need to put the word developing country. We can put it in developed countries now where we don't want to use the drill. This can be a beautiful alternative. Okay. So now, what is the advantage of silver diamine fluoride? It is child friendly and it can be adult friendly also. No pain. And the word painless is wrong. It is pain free. No injection is required. No fear, no drill. And it has got fluoride at the level of 44,800 ppm and the pH is 10. And it is very cost effective. The bottles are in the range of 2 to 8,000, around 5 to 8 ml are available. Okay, so the cost is also not so high. And of course, I have a video which I will be trying to show at the end of the presentation. Now, the main indications of where would you use silver diamine fluoride? See, silver diamine fluoride, I mean, especially when, see, these days, many people, or previously also many people used to go for dental camps. Now, dental camps are a great thing and they do a lot of good help to the society, but what happens, we have just done a checkup and we have given them basic instructions. I mean, we have not done any work. So in such a situation, that if you can manage a lot of Vaseline and cotton rolls, you can always apply the silver diamine fluoride and at least, prevent or arrest the dental caries. So it becomes a great service to the kids. And in this time of COVID, I mean, no better material than silver diamine fluoride. But the only thing that you have to remember that the main contraindication for silver diamine fluoride is that if you see an obvious pulpal or periapical pathology or a gingival disease or a periodontal disease already present, then don't use it over there. Okay. And of course, the patients, if they are allergic to silver, in patients who are allergic, you need not use. But those patients where you know that, and especially in situations like this, it helps you to postpone and arrest the carious lesion so you can see him a little later. A follow-up after 3 months or 6 months can always be done. But no silver diamine fluoride should be applied without a radiograph preferably. Or if you are confirmed that the caries is, there are no pulpal or periapical pathology, then you can very easily use silver diamine fluoride. Now comes another technique where again we do not require the drill, where we do not require even, drill is not at all required. I mean, I just wanted to ask a question. Can we give a crown? Now this particular process is for a child only. Can we give a crown in a child without drilling? Is it possible? Is it possible? Yes, one guy replied that it is Hall's technique. Yes, we are going to discuss the Hall's technique. Now, many a times in many practices, what happens, the children are not very cooperative, where they will not allow you to use the drill. Okay. And you see multiple carious lesions and your restoration is not going to work. So in the many a times we propose the general anesthesia. Now, not many patients want to get their treatment done under general anesthesia. So in this situation, how can you give a crown without doing a crown cutting? I mean, no proximal slicing, no buccal reduction, no lingual reduction, no coronal reduction. Is it possible? I mean, it sounds very, very tough because, when you are doing a composite restoration, we are always taught the most important thing we check is high point. And when you're giving a crown without crown cutting, there will not be a high point. There will be a big high area. So you can imagine what kind of discomfort the patient might go through. But that is the beauty. Now, this Hall's technique has been suggested by Norma Halls. Now, the basic question that she asked everybody is, do we need to remove all the caries? Okay. I mean, now cariology is moving in a different direction. Initially, what did G.V. Black say? We had to remove the complete carious lesion, extension for prevention. Then came Bunocore. What did Bunocore propose? The composite. Okay, where you removed only the carious part. And now another component has come where it is called as the Hall's, where they are saying that we need not remove the caries, because what happens is that they have proposed, just one second, I have missed out. What they propose, I mean, this I'm not talking about the Hall's technique, but as far as the carious lesion, see, suppose, or just one second, I'll discuss and then I'll come to that directly. Now, so here the Hall's technique, what does it propose? That you do not remove the carious lesion. But before doing a Hall's technique, be assured that there is no pulpal or periapical pathology, and also check that radiographically there is no periapical or intraradicular radiolucency. Anything that indicates about a pulpal or periapical pathology, then you can't do a Hall's technique. So you be assured that the caries is there, but it is not involved the pulp. So in such situation, what are the steps? Now, this was the beautiful technique proposed by Norma Halls, in which she says that it helps in managing carious primary molars by cementing preformed metal crowns over them. This technique is named after Norma Halls, who was a general practitioner from Scotland who developed it and used it for over 15 years. Okay, now what is the beauty of this technique? That no anesthesia is required, no caries removal, no crown preparation, no tooth reduction. Nothing is required. I mean, all of you all would have seen a stainless steel crown ka kit. Okay, so what I always, when I take my lecture, I always actually give a live demo of this. What we generally tell that you start with the lower Ds. Okay, whenever you see a D with a proximal cavity, see, understand doing a proximal, that is a class 2 filling in a deciduous teeth, is very tough. Okay, and many a times the class 2 restoration fails. And then most of the times when you have done a class 2, after maybe a few months, the patient comes with a dentoalveolar abscess and you start wondering what went wrong. So in such situations, always better to give a stainless steel crown. And the Norma Halls, what she mentions is that you select the crown. So how do you select the crown? It is on trial and error basis. From your box of crowns, you try the D1, D2, D3, whichever fits in, you just cement that directly into position. Now your question will be, Okay, what about the crown cutting? Not required. Okay, what about the carious lesion? She says there's no need to remove the carious lesion, just remove the debris. That's it. Okay, do we trim the crown? She says no, there's no need to trim the crowns. And then when you place the crown, you will see a lot of blanching. So people say, will the blanching be affected? She says there's no issues if there is a little bit of blanching. Then the worry which everybody has, what about the occlusion? She proposed that the dental occlusion in children is very dynamic, and in follow-up visits, maybe after 3 to 4 days or 7-8 days, and when you recall the child back, everything is back to normal. The pediatric occlusion is so dynamic that this is also taken care of. Of course, there are, see, remember, any techniques, there will be two schools of thoughts. There will be people who love this technique and people who oppose it. I always, follow medium part. Wherever I can use it, I use it. If I, it is my emergency protocol kind of a thing for me, halls. Okay, wherever the child is not sitting, not cooperating, they are not ready for a general anesthesia, I prefer to give the Hall's technique. I don't do it in each and every patient. Now, what are the contraindications? You see an abscess, you see irreversible pulpitis, any signs of pulpal and periapical pathology, you're not going to use the Hall's technique. Now, indications are simple. Caries extending only up to the dentine, proximal carious lesions. Now, how does this technique work? Now, it is the whole concept is about changing of the environment. See, if the environment is changed, okay, now how are we? See, there was a time where we were busy from morning 8 till 10. Now our environment has changed. Have we not changed? So the change of environment changes everything. How many of you all ever thought that we'll be off the dental clinic for a month or 2 months under normal circumstances? Never. We never thought of anything like this happening to us. The only thing we have been off from the clinic is generally on the weekends or when we are genuinely ill. Okay. So whenever there is a change in environment, so what happens to the carious lesion? If the carious lesion, the environment is changed, the caries will not progress. Now, what happens in the Hall's technique? After you have placed the crown, okay, it seals the tooth. The plaque environment is manipulated. It separates the tooth from the substrate. The bacterial profile changes and the carious lesion doesn't progress. Now you will say, how is this possible? It is possible. It is 15 years of research. And we ourselves in our department have 3 theses going on. And it is one of the best techniques we have ever come across. Wonderful for uncooperative children. And it is genuinely easy. Now, the only problem is that if the contacts are very tight, how will we manage that? You can't really press it into position. Now, remember one thing, we are all normal dentists. We don't have Sunny Deol ka hands and fingers of 2.5 kilo. Okay, we have normal hands. So in such situations, what you do, you just place separator, call the patient after 24 or 40 hours, and then place the crown in position. It is as simple as that. So now what is the protocol which is followed? The food debris are removed from the cavity, but no caries is excavated. Child is positioned upright in the dental chair, and because it reduces the chance of accidental swallowing or aspiration, correct size of the crown is selected, which covers all cusp and giving the feeling of spring back when placed, but not through the contact points. If the contacts are very tight, as I mentioned, if the contacts are very tight, then you can always place an orthodontic separator. Okay. And then once you have selected the crown, you fill it up with the luting cement, position it on the caries stone and just press it into position. And the only instruction that you tell the patient is that be on a soft diet for the next 1 week, and he should see you after 7 days. Okay. Generally in 7 days, the different feeling in the mouth generally settles down. Okay. Now this is the video which I'll be showing you at the end of the presentation. Now, management of a non-vital tooth. Now, this I'm talking exclusively of the deciduous teeth. I'm not talking about permanent teeth, because for permanent teeth, there are definite procedures which are there. But management of a non-vital tooth is many a times very difficult. Because see, many a times you come across a non-vital D or a knee, and then what happens? You do the root canal opening, and then you give an open or a closed dressing, depending on which school of thought you follow. And then next pay appointment, you call the patient, and the moment you place your reamer or file inside, there is some amount of bleeding. So what we generally do, we irrigate that area, we try to debride it, and then give a dressing again and call back again. See, many a times in a non-vital deciduous tooth, the bleeding which is encountered from the canals is not because of remnants of any vital tissues. Many times it is the resorption that is set. Okay. So now, one question, many of you all are doing endo regularly in your clinic. Can we do any endodontic treatment without reamers and files? Is it possible? Anybody? Can you do endo without a reamer and a file? Yes, anybody? I mean, I think not possible only. Yes, everybody say, how can you do endo without reamer and file? And this technique which I'm going to discuss, LSTR, is specifically for deciduous dentition. I'm not here involving the permanent dentition. Okay, so now what is the LSTR that we are talking about? The full form of LSTR is lesion sterilization and tissue repair. And it is a simple method of placing antibiotic combination inside the infected pulp chamber. The therapy aims to eliminate the causative bacteria from the lesion by sterilizing the lesion, promoting tissue repair and regeneration by the host's natural tissue recovery process. Okay, lesion sterilization and tissue repair. Now, who developed this concept? Now, this concept was developed by the Department of Cardiology unit of Niigata University in Japan. Okay, so Japanese work is, you can definitely trust much more than anybody else's. Okay. And the antibiotic combination with the proposals, 3 types of antibiotics are combined together to ensure complete eradication of the pathogenic microscopes in the periapical areas. And the triple antibiotic paste is formed by mixing the powder of the antibiotics with the macrogel or propylene glycol, which acts as a vehicle. Of course, some authors have suggested the use of normal saline, LA solutions, distilled water, but propylene glycol is preferred. Okay, now what is the combination which we use? Hi, what happened? Hello?
Hello?
Yeah, any noise coming in between? Any query? Okay, now the triple antibiotic, which, I mean, the question which comes to everybody's mind is which triple antibiotic paste should we be using? Now, the triple antibiotic paste which we should commonly be using is ciprofloxacillin. Okay. And then you have metronidazole and minocycline. Okay, this is the basic triple antibiotic. Just a second, I'm just putting my iPad on charging. Yeah, okay, that's great. So this is the 3 antibiotics which are commonly used. Now understand one thing. I mean, you will say, can I use this antibiotic, this combination, that combination? See, now these 3 antibiotics have been tried and tested and well researched. Okay, if you propose another group of antibiotics, then you please publish your data. I mean, give us the research results and all that. I mean, it has to be done scientifically, because otherwise, it becomes just a layman's method. So these are the 3 antibiotics which are used specifically, and there are a lot of literature is supporting these 3 antibiotics. Now, what are the indications? See, all the contraindications of SDF and this one, which was the Hall's technique, which we mentioned, are the indications of this. Any non-vital tooth, okay, any signs and symptoms of irreversible pulpitis, okay. So those are the indications. What are the contraindications? Of course, non-restorable tooth, teeth which have to be extracted. Now, the clinical steps are very, very simple. Now, understand that your reamers and files will not be required in this process. Okay, you have to keep them aside. It is very difficult. The moment, because what happens, our hands are used to that reamers, file, and rotary stuff and all that. So how can we do endo without the endo instruments? So here the process is very simple. Rubber dam isolation is ideally proposed, but if you can't, then you can always use your other methods. LA is not required because the tooth is generally non-vital. Okay, caries removal is done, access cavity preparation is done. Now here, I mean, you'll say, okay, access cavity, you can definitely do it with the help of your Carisol or Papa Caries or any of the chemomechanical agents. And then you extirpate the necrotic coronal pulp. Then you irrigate it with normal saline. And then you dry it with cotton. Okay. And then you have to enlarge the orifices a little bit. Okay. 1 mm and 2 mm deep, so that the medication cavity is created. Now, what do you fill the medication cavity with is the triple antibiotic paste. Okay. And then the tooth is restored with glass ionomer cement directly. Or you can, and then you can place a stainless steel crown over it also. See, now many a times what happens now, our heart will not agree that the tooth is abscessed. So how can we, directly seal it off? So, okay, so the choice is yours. So in situations like this, you can do the access opening, extirpate the pulp, give the triple antibiotic paste, give a closed dressing, call the patient after a week. The abscess you would have drained at that time, buccally or lingually also. And then if the abscess has subsided, then you can, add another, irrigate the cavity, okay, and then place the triple antibiotic paste again, put a layer of IRM, give your GIC, and if you want to place a stainless steel crown over it, definitely you can brace over it. So these are the steps. Now this is one of the cases which we did. Now the patient came up with a dentoalveolar abscess, okay. We did the root canal opening, we placed the triple antibiotic paste, we placed the crown, and this is post-operative follow-up. It works fine. See, what happens is a non-vital deciduous tooth is a very dangerous thing, you know. And, as far as I was taught and I prefer is that the moment I see a non-vital tooth, I love to extract it also. But many a times the patients want to keep it, and especially the D's, believe me, I never leave a D, upper or the lower, whichever D is there and it's got a big abscess, I just prefer extraction and I place a space maintainer. But sometimes you come across an E when the 6 is not erupted, and many of us are not so well versed with the distal shoe space maintainer. So, or if the patient also insists many a time that, sir, you don't extract this tooth, then in such situations, what you can do is you can always maintain the tooth with this particular method. Please, and because many a times we want to use our instrument, please don't use the instruments. None of the reamers and files are needed in this situation. Now, what are the advantages of LSTR? It's easy and simple technique, one short visit. Of course, you can make it 2 visit, also economic, painless, no instrumentation, no irritation of the periapical tissue, no obturation, and no use of any agent. No intracanal medicament is also required in such a situation. Mogambo definitely khush hua hoga. And then we talk a little bit about smart dentistry, because we are all smart people, and a lot of preventive things will become more prominent in this particular situation. So all of you, as I discussed the silver diamine fluoride already. And then you have something called as the GC Moves. I hope all of you all are aware. It is very effective for children, especially in management of incipient carious lesions in the initial stages, and the patients can themselves apply it in the house. Okay. And then you have something called as a smart burrs also. Now these are special polyacrylic burrs. Now this you have to use with your micromotor handpieces. Okay, so once you start, and the beauty of this burrs is that they remove only the infected dentine. They will not touch the affected dentine or the normal dentine. Okay, because the hardness of the infected dentine and the hardness of the affected or normal dentine is different. So the moment you try to press it, the tip of the burr breaks. Okay, so the moment the burr breaks, be assured that the infected dentine has been removed. Now, what I always tell everybody, that don't try to break it in every patient. I mean, many things, once your excavation is done, keep on checking it, because you can definitely use this burr at least 2 more times. Okay, this is a very good technique and it works very nicely. And the amount of aerosol produced with this is minimal. Okay, because now we have to focus on those products and system where the aerosol generation is the minimum, because every practice today is worried about aerosol. Okay, I just discussed. And then there is something called as a pink GIC. This is an ideal agent for indirect pulp capping. Just a second, please. It's a beautiful agent for indirect pulp capping. And the beauty of this material is that though it is called pink GIC, when you mix it, it gives an orange color. So in those situations where indirect pulp capping is indicated and you feel that the pulp is going to get exposed, just place a layer of it and do your routine restoration over it. Now, if at all you want to re-enter, see, previously, when we used to try to re-enter, we should not know where that GIC was or where was our IPC material. But here you will definitely see an orange material, so you can always access that areas. Now, idea number 7. Okay, so we have discussed this basic painless and pain-free ideas. A little bit of information on these things that we are generally very scared lot. Okay, because we have never looked beyond local anesthesia. See, because now in times like this, I mean, because as we are going through a lot of sessions on how will we be practicing after lockdown, many experts have proposed the use of general anesthesia. Now, as far as pedodontists are concerned, we are very comfortable working in under general anesthesia. But what about adult dentistry? Because the number of patients any dentist would have done under general anesthesia is minimal. We're not talking about the oral surgeons, but the other doctors. So now we have to think about general anesthesia also, because it can be a little, then the local, it can be another alternative. And of course, laughing gas is a good alternative, which we should start thinking now. Okay, see, many things which were meant only for the periodontist, now the situation has come that why not use it for adults also? I mean, it really works. It was discovered way back in 1772, okay, by Joseph Presley. And if you check in the history, local anesthesia came much later, okay, and it has become very, very prominent. So now, my friends, I will not, of course, I will take another full session on nitrous oxide, but we have to start thinking about nitrous oxide also, because it is a good technique, okay, because you achieve minimal sedation, not moderate or deep sedation. And the best part is the responsiveness when we are using. There is normal response to verbal stimuli, airway is unaffected, spontaneous ventilation and cardiovascular function is normal. So the beauty of the laughing gas or the nitrous oxide oxygen is that the safety component is very good. It is safer than the local anesthesia also. So now we have to get that part also introduced in our practice too. Sooner or later, that is going to come. Now, what are the advantages? Rapid onset. And it really works well. And the best part about nitrous oxide is that you don't have to admit the patient. And it is highly comfortable, and it reduces the anxiety and fear to a considerable extent. So now the post-COVID thing or the post-lockdown, we have to start thinking, boss, I need to have those tools which will, make my dental work easier. Now, many invasive procedures will have to be done with great caution. Now, the last part of the presentation is painless to pain-free dentist. Okay, dentists, we as dentists, we have made all attempts, okay, to make the lives of our patients, the procedures painless to pain-free. But what about us? Now, a simple question I like to always ask everybody: how long do you want to live? Anybody can give me figures? How long you want to live? 10 years more, 20 years more, 50 years more? Everybody wants to live short or long? Chiranjeevi, 40 more. How old are you, Sandeep? 60 more. Sumesh, very good. But how you want to live? Ekdam healthy, hale and healthy, or? So majority of us would want to live 100 years, definitely. 40 more. So Sandeep is 60 years old. But how would you want to live like? I mean, see, if given a chance, I would like to spend my life like Amitabh Bachchan here. Look at him. I mean, he's a wonderful example that how life should be, lived. I mean, you are his fan at all age, fit and fine. I mean, no comparison. Okay. Now, studies have shown what is the lifespan of a dentist. Most of us, by 60 years, we are done, and active practice, 25 to 30 years. A little less, unfortunately, because the amount of work which we are doing, it's tremendous. Are we working in this manner, bending, unusual positions? Everybody will agree that we are breaking our backs to a considerable extent. So now, why should dentists and dental students take care of? Because 70% of dental students reported with neck pain, shoulder pain, lower back pain. In fact, third-year students have suggested that ergonomics becomes a very, very important aspect. Okay, we have seen our kings previously. Why were they so healthy? Our kings, our older generations, why were they so healthy? And of course, spondylitis, as mentioned by Sandeep and Soumya, yes, all that is very, very common because of the posture. Because whole day we are sitting either in front of the computer or on the chair, our posture is wrong. See, our ancestors survived because they sat on horses. See, the horse saddle is the best position for a dentist to work on. So now, see, the normal stool looks comfortable, but look at what it does to our backs. It doesn't help our backs much. So now, my sincere request, all of you should look at the position you are working in. Saddle schools are available. You should look out for people who are selling them. Get it organized. It is not only for the dentist, the others too can use them. Eye fatigue, most of us are very much dependent on our eyes. No loops are available. Microscope is a little difficult, but definitely you can start using loops. It will definitely improve the quality of your work, and the fatigue on your eyes is taken care of. Now, I think we are almost done with my presentation because Chai Pe Charcha is generally the break for my second presentation. Now I will just check if I can load my videos, or if the time is up, should I load my videos at the start of the next presentation next time? What is everybody's view? Because it's almost 5 o'clock now.
How much time videos are there?
The video another, I mean, you know, Aditi, are you there?
You can put the videos.
Yes, sir.
Aditi, can you start posting the videos, please?
Yes, sir. Yes, sir. You have
So
to
just, I
stop
mean,
sharing your screen.
So I will stop sharing my screen now. We will have Aditi and I'll be discussing those videos. Okay.
Okay, sir.
Is everybody okay with that?
Yes, sir.
Yeah. Now, Aditi, you please share our videos.
Yes, sir.
This is it's a dental vibe. This is the dental vibe. Yeah, start with the video. Can you see this machine? And this is the anesthesia being placed. Aditi, the video is playing in parts here. This is how the device basically looks. You have to place the needle in between the two prongs. Okay. And look at the child's eyes. He's not experiencing any pain whatsoever. Now this is the lingual infiltration. All other process remains the same. Basically, you apply the topical anesthetic, you apply, the speed of the flow, or the flow of the anesthetic has to be 1 ml per minute, not beyond that, because there's never has to be any hurry as far as the injection is concerned.
Can I ask you a question on this?
Yes, yes, please ask me.
Sir, as of now, all the kids are normally, fearful with the armamentarium itself, right? They are really afraid of seeing this.
Yes.
So don't you think introducing a Vibrajet as an extra armamentarium during giving an injection won't make the kid more fearful?
You see, because what happens, it doesn't look like an injection and they're used to a different kind of a device. No? And you can give it to them in their hand to hold. They'll feel, you can, play around with them for some time. And what I always do now, first I do it in an elderly child, because the tell show do technique works in this. Because whenever I want to use this for a smaller child, what I do is I give a demo to the child on an elderly patient. So the tell show do you have to apply. So once they see the person, sitting nicely, then their fear goes away considerably.
Okay.
Yeah.
Thank you.
Yes, Aditi, what happened in the next video?
Yes, sir. I'm sharing.
They are playing very slowly, right? While this way.
So the net over there is slow.
Yeah, there is so now this is the wand device which I am using. See, now if you see, the needle is, in my pen grip, the patient doesn't see it also. And see, look at her response. She's not knowing what is happening. And it has got an aspiration and a non-aspiration mode also. And see, can you see the child is actually laughing and smiling? Because as the earlier question, the dental vibe is looking little different. But here what happens? They can't make out only. You can hide it and just carry it inside.
Right.
In this, but in most of this technique, the tell show do works very nicely and the child doesn't see it now, so they are very happy with it. That was the STA which we used. I will try to get the actual videos loaded by Monday. So when we start with the next presentation, next time on Monday, I'll try to get that also with a little. And this is the SDF application. You just isolate, then you apply your Vaseline. Okay, these, I mean, here the child is quite uncooperative. It has been held in position with the help of, what happened?
It's in parts. Video is in parts.
Okay,
Two parts.
okay. And after you have applied, see, this is the carious lesion that you saw. And with the applicator tip, you have to just apply the solution, wait for a minute or two. And then you have the option of telling the patient to go by, tell him to go away also. I mean, whether if you don't want to do any further treatment, it is also fine. Or if you want to do any further treatment, that also is fine. It all depends. At least, some good work is done to the patient, and we can, they can buy some time. Because, children never come with one cavity. They come with a dozen, 10, 12. So many times the budgetary constraints will also be there. So in such situation, you have to help them out. And the level of confidence increases. Now, what I did is I modified the Hall's technique because I'm always scared to use the normal Hall's technique directly. So what I do is that first I apply the SDF over there. Okay. And after application of SDF, I put the Hall's technique. I use the Hall's technique. Okay. Now I've applied the Vaseline. I'm so sorry for the speed of the video. Mostly maybe on Monday, I'll try to get. Now this is a small proximal lesion. Class 2 is something I dread in my life. And many people ask me, sir, why you don't do class 2? I say, I'm a class 1 person. I don't get involved in class 2, class 3, class 4 activities. You can ask, and this is we have tried out the crown. Yes. It's fitting in. Of course, some amount of blanching will be there, but that is accepted. There is no problem in that. Then you take the luting cement, fill up the crown with the luting cement. See, as far as one question has come, which brand of SDF are you using? I generally use the Advantage Arrest, but we have a very good SDF developed by our own Bombay guy, Dr. Mukul Jain. He has given a very beautiful SDF, Kids E-SDF. It is good. You can try that. And then there is a Brazilian one also. And there is one Australian one which comes with a potassium iodide. But all those who are in Bombay can definitely call up Mukul Jain, give him my reference. He's a very good friend of mine and he's prepared a very nice SDF on his own. So you can definitely use this material.
Any chance in UAE?
UAE, you will be very easily be able to get the Advantage Arrest. Because Advantage Arrest comes from USA, you can definitely, and the Brazilian product is also there. I mean, you just Google it and it is available very easily. Any more questions, please? Or you can collect your question. I'm back on Monday also. I'm so what is this mechanism of action of SDF and MMPS means what?
Matrix metalloproteinases.
I didn't get it. Pardon?
Matrix metalloproteinases.
I'm not aware. I'll have to check it up,
I have a question over here.
Wonderful lecture, doctor.
Yeah, thank you so much. I mean, I'm so sorry for the little slow videos and of course I could not provide any entertainment, but Monday I will try to make the lecture as more entertaining as possible also.
So yes, you can.
Yeah, we can restore the tooth immediately after the SDF application. But as I told you now, as far as the composites are concerned, some studies have shown that there is no effect on the bond strength, but some studies have shown that there is effect on the bond strength. So what I always suggest, you directly give your GIC restoration, and if it is a posterior, you can always give a stainless steel crown over it. And even if you leave it, see, because one more technique that has been proposed is that after you have applied your SDF, you create a proximal slice also, a self-cleansing area also. Because see, one of the major causes for arrest of caries is self-cleansing areas. So in such situations, you can use whatever combination is possible. Thank you, Dr. Jayan. Thank you for your kind words.
Dr. Jashan,
Yes, sir.
your question?
Yes, sir. We have a question over here.
Yes.
It says, does the Carisol stain the tooth?
No, it doesn't stain the tooth. See, because what happens, it is basically sodium hypochlorite. See, the main component of Carisol, we have noticed that it is sodium hypochlorite, and it is a colorless liquid, but they have put a blue color so that it becomes more effective to use. You can differentiate, na? Whether the gel is there or it's washed out with saliva or what. So blue is just the coloring agent. And you, after you have done your application, you have to just, like irrigate it with normal saline, and then you can do whichever restoration you want.
Great. No more questions on my end. So Virat sir, do you have some questions?
Yeah.
How to sterilize the
Friends.
vibrating tip? I think cold sterilization should be enough. And actually those tips come in disposable format. A big bunch comes with that. So you have to use a new tip for every patient technically. And even the VAN device, it comes with an individual syringe system only. Okay, so you have to discard it after use with every patient. I mean, there is no question of reusing it at all.
So good evening, sir. Can you hear me?
How
Yes,
expensive
I
is
can
that?
tell you. See, as far as STA is concerned, I think the price of it is $2,500 USD. You can always check on the net, and that packet costs $2, I believe. So the application, but the beauty of it is that the patient is very happy and satisfied. It increases the running cost, but it is very effective for the child. So in pediatric practice, what happens? We are very much comfortable using that.
So good evening, sir.
Yes.
Sir, can you please mention the trade name of the vibrator, sir?
It is called as Dental Vibe only. I mean, on
Vibe.
the internet, it's called as Dental Vibe. Of course, alternative of that is available in India also. So you can just Google it now. You will see, because I'll be very honest. I don't deal in any of the materials. I just use them and I talk about them. Most of the time we have used it, and all the techniques which we used are our thesis projects. So we have used the material extensively. So then,
Thank you, sir. Very entertaining and informative, sir.
Thank
So,
you
but
so much,
doctor, but when it's given on the palatal, how do you do that?
Pardon?
Palatal injection. If you want to give, how can you use the vibe?
It works, ma'am. It works. You have to place it. I mean, you have to because it is just two simple prongs, and you place it over there and you give it. It works. And if you see what happens, even if you feel that if you can't place it palatally initially, you have to start with the elderly kids, because in the small child it is a little difficult. But kids who are 8+, you can use it very easily. In a very small child, it becomes tough at times, and even giving the inferior alveolar nerve block is difficult at times. So infiltrations you can start in the initial stages, and once the child is comfortable, then you can give the palatal. And palatal, what I always prefer the STA, because STA, what happens after you have applied your topical, you give in the sulcus the anesthetic. So from the sulcus, then you move into the palatal area. That's how I give the palatal injection.
Thank you, friends. Thank you, Yusuf sir. As it is said, a lovely lecture. Majority of the doubts, specifically in pediatric dentistry, the pain and fear has completely vanished out from these participants today. Post-COVID, they will definitely they will definitely be ready to treat each and every kid with smile and passion and vigor, sir.
Yes, and I told you, SDF can be used for adults also. See, whatever a kid likes, the adult likes also. I mean, if you tell adult also that it's not going to pain, he's going to be more than happy. I mean, it's universal. Pain, fear, and anxiety is a universal phenomenon. It is not related only to children or only to adults. It is a universal thing. Thank you so much. Thank you, IDA, MSB, MWSB for your all your help, and thank you, Dr. Jashan and Dr. Puneet also.
Yeah.
Thank you so much.
Yeah, thanks a lot, sir. So it is rightly said. Fear is good for nothing, and that is what has been explained today in detail. Friends, Dr. Yusuf Chunawala will be available on WhatsApp to answer your questions today. If you have more questions, he's back on Monday once again with a webinar lecture on bad breath. You can definitely ask few of your questions at that time. He'll be really happy to answer you all. Tomorrow we have Dr. Kapil Golwankar speaking on post and core in the anterior aesthetic zone. See you tomorrow. Like in Yusuf sir's language, you would say, happy evening, sayonara, shabba khair, good night, see ya.
Yeah, bye. Thank you
Bye,
so
sir.
much for your precious time. Thank you so much.
Thank you,
Dr.
sir.
Jashan, Dr. Jashan, can you please end the meeting?
Yes, sir. We'll be ending the meeting now. Thank you once again, sir, for the fantastic lecture. It was entertaining and very informative, sir.
Thank you so much. Yeah, thank you so much. Yeah.